stones. And the average age for these symptoms to appear is 4 years and above, although I have had patients that are younger develop these signs as well. Once you're a male, you are predisposed to becoming blocked.
So somewhat like human males who develop prostate cancer, is it a function really of that urinary tract and how it's made up that causes this?
Yeah, the urinary tract is not very... I would compare, because in veterinary medicine, we do comparative medicine. If you compare it to the dog, if you compare it to another large animal within their category, the cat's penis or urinary tract is smaller and very
delicate.
Yeah, very delicate. And there is a nice little curve by the pelvic brim that your stones could be lodged or your crystals could be lodged. So the makeup or the anatomy of the cat didn't work well in their favor. So that's also something to consider.
And some of these symptoms now.
Right. So some of the symptoms, bloody urine, straining to urinate. I would want all your listeners to be very, very careful. Sometimes it can be mistaken for unable to pass stool or constipated. I've had a lot of patients come in for possible constipation, but when I palpate the bladder, it's unable to urinate is really the issue. Urinating in unusual places and constantly looking at the urinary opening is also a sign that you want to look out for. Those signs are what you see. So when they're going to the litter box, sometimes they cry out. You actually hear them cry out when they're trying to pass their urine and they're unable to. I'll just iterate right here that a blocked cat is an emergency. At no point is it okay to wait when you realize that your baby is unable to pass urine, right? Because eventually that pressure builds up in the bladder and it can rupture. And then he can pass away if not immediately seen to.
What about those of us whose cats don't use the litter box?
Well, that's where your human-animal bond will step in. So your cat will actually try to tell you something is wrong, whether they're bellowing out, whether they're paying you a lot more attention than usual, whether there's obvious signs of discomfort when you try to pick them up by their stomach area. That's a really good question because, well, my cats are mostly inside, so I would see these things or hear these things, but there are the category of cats that use the litter box outside, and you would not know whether they have diarrhea, whether they have a urinary issue, but believe it or not, your cat will let you know when something is wrong. And I would have loved to have everyone try to look out for those signs a little bit more. And you would know the personality of your cat. You would know if they're super independent and they see you for breakfast, lunch, and dinner, and then they go to their jobs on the side, or you would know if you would notice if they are super needy compared to them being independent, or if they are usually needy and they are hiding from you. So this is where the bond that you guys have would present itself, and you zone into those clues and those signs if your cat is an indoor-outdoor cat and he doesn't use the litter box inside.
So apart from being in tune with your cat and can recognize when something is wrong, because as we know, cats are notoriously secretive about when they're hurt, is there anything that pet parents can do to prevent the onset of these kinds of infections or disorders?
Good thing you asked, because the number one thing that is super important is hydration and diet. Your cat needs to drink a lot of water or have a lot of wet food or water supply that is constantly available to them, because that really helps your urinary system flush out any toxins. It helps neutralize the pH of your urine, because some stones develop in more acidic or more alkaline urines. I would give you guys some suggestions. A lot of canned food, my kids, and once again, you know your kids, my own loves the patty, but not the chunky bits. So they're offered the patty over the chunky bits of meat. I have water fountains available Cats love running water for some reason, as well as, most important, diet. Now, ProPlan has urinary tract health, but they're also, Purina One Tract Health is also one of the best urinary chows for your cats. Also, there is Hill Science Diet, Urinary Hairbowl Control, Royal Canin Urinary Esso, and those are the top brands of food that I would recommend. But seeing as ProPlan is easily accessible, it's the one that I have my cats on predominantly.
And is this something that people should, well, I guess you shouldn't wait until you see a problem to switch diets, but maybe it's something you can introduce after they attain that age?
Once your cat is neutered, urinary tract health should be in their diet. I'm not a big fan of Friskies. Like my boss tells me, Friskies is like the KFC of our diet. We wouldn't eat KFC every day.
Oh, snap. Wow.
Yes. So we wouldn't want to give our kids KFC every day. It's just not a healthy option for them. It's the best palatable chow for them. I know a lot of cats that if it's not Friskies, they will rather starve themselves. And they're very stubborn about it. But we do have to overcome some of their stubbornness and do what's best for them.
So you're recommending as well equal mix of wet and dry food, but wet food is preferred because it has more water in it.
Water, right. And there's some cats who are very stubborn in terms of drinking water. I've known a lot of my clients say, I don't see them drink a lot of water. It's like, yeah. So this is where we trick them into drinking a lot of water. And we give them lovely canned food that has the sauce in it. I add a little bit of water. Well, my cat family don't really shy away from drinking water, so I don't have to really trick them. But if your cat isn't one to love drinking water, you notice, and this is a tricky one with outdoor cats, you don't know what your cat is drinking out there. It's definitely not filtered water. So you have to be the one in control of their diet and offer them canned food as well, just to make sure that moisture is there for them. That's super important.
And finally, on this topic, treatment. When you do notice that something is wrong, you take your cat to the vet. What can be done to help?
Immediately. So when you take your cat in to the vet, they will assess the reason why. Now, when my boy was blocked, it was because of a urethral plug. And that's just a bit of mucus that has kind of solidified itself to the entrance of his penis. And we had to sedate him, pass a urinary catheter. One thing that we do is keep the patient on fluids for 48 hours because we want to flush those toxins out. Now, your kidneys are in charge of expelling or getting rid of waste products. When it's unable to do that, there's a backlog into your blood system and it becomes a toxin. So your cat becomes very sick. And I'll use a layman term, it's almost like poison to them. So another thing that happens is your potassium is elevated because once again, your electrolytes are off and your toxins build up in your body. And that creates a cardiac insufficiency or a cardiac disturbance, and it lowers your chance of survival, actually. So when your potassium is really high, when your vet does blood work, understand that if your pet has to be sedated, it reduces your survival risk. So what your vet will do is take blood, see where he's at. Usually your BUN and your creatinine are elevated, and immediately they will, once it's okay, sedate, pass a urinary catheter, express or relieve that pressure buildup in the bladder, put your cat on fluids, hospitalized for 48 to 72 hours. We usually take a sample for culture and sensitivity to determine if we also have a urinary tract infection and put them on the right antibiotics, and also pain medication because it's a very, very painful thing. Once all of that is good to go, most of us repeat our kidney values to see if we're back to where we want to be, because the kidneys have a very good way of quickly correcting metabolic disasters that have taken place. So once you keep them on fluids and you provide a patent urinary system, a closed urinary system to get that urine out, we are back on track with getting your pet to you. And when we have a closed system, we're able to see the color get better. So initially we were bloody, we're clearing up, and we're getting that nice normal yellow color that we're accustomed to. And that's when we know we can pull our catheter maybe by the third day and send them home on the correct chow. And we also do a cytology to see if we're any crystals.
You just mentioned crystals. That is something I've heard before. Is that in the category of the idiopathic symptoms?
Crystals are what congregate together to form our bladder stones. So if we caught it early, rather than bladder stones, we'll see crystals.
And is there any surgical remedy in terms of, I don't know, maybe widening the urethra or making it so that they're more like a girl than a boy? I mean, I don't know if I'm describing it right, but is there a surgical treatment for this as well?
It's not one we run to right away because it does predispose your cat to urinary tract infection. But there's perineal urethrostomy where we make your boy basically pee like a girl, and he no longer has his penis. He would just have an opening that would go from the bladder to the skin. So in very, very severe or cats with repeated feline lower urinary tract disease, that is an option that we do for pets that are constantly being blocked despite whatever medical interventions we may have had placed for them.
Well, I think that just about covers it, unless there's anything else that you would like to mention on this topic.
I think providing nutritional and emotional support for them to make them as happy and healthy as possible is the best thing that you could do for your cats. And once again, nutrition is super important. Stress is also something we also need to consider for cats as well, just to make them more comfortable and happier pet. It's our responsibility to make them as happy as possible.
My next question is about animal welfare in Trinidad and Tobago. Is there one major issue as it relates to animal welfare, something you would like to see happen, something that needs correcting or addressing immediately?
For one, I'm extremely glad that we have legislation that has passed for animal welfare. We do have a long way to go, but I think it's the step in the right direction. One day I would hope to not have any more stray animals, but we have to be responsible as owners to spay and neuter our pets, as well as I do think the government also has to play their part in stricter laws or follow through with their laws that they have put in place for these animals. So for me, what I would like to see eventually is that we no longer have a stray population to care for, as well as I've seen a lot of cases where humans take out their frustrations on their pet or don't provide the right home for them. And I think we still have a long way to go in terms of what we need to provide for pets, because sometimes people think of what a pet can provide for them. As in a dog, for example, that's to protect my yard, but apart from the 5 freedoms that they are entitled to, you also, believe it or not, they are emotional beings as well. And they look for you for support and comfort and engaging with them as well. So that's one of the things in terms of animal welfare where we should be going to.
Let's hope so. I mean, we all try to do our part. So actually, this podcast is one way of creating a community around animal welfare issues. And hopefully, when we do start raising our voices to the powers that be, they will pay attention. And finally, this is for all of the other gooners. You're an Arsenal supporter, like myself.
Well, funny story. I'm actually an Arsenal supporter by extension. So my boyfriend at the time, who is a huge Arsenal fan, as in we went to the Arsenal stadium. We had a tour. We got merchandise. I have an app that tells me whenever Arsenal is playing, and I get updates as soon as. So while I'm not a huge